So if you have a physical covering with one layer, you put another layer on, it just makes common sense that it likely would be more effective. And that's the reason why you see people either double masking or doing a version of an N95. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
You and the president have suggested that we'll approach normality toward the end of the year. What does normal mean? Do you think Americans will still be wearing masks, for example, in 2022?
You know, I think it is possible that that's the case. And again, it really depends on what you mean by normality. If
right,
normality
that's what I want you to define
exactly the way it...
It is likely that if you are vaccinated, that you are not going to spread infection if you get infected without any symptoms. There's no doubt about that. I understand that as well as anybody else. But there is studies that are coming online now that are going to definitively prove that. And that's the reason why we say when that happens, we'll pull back on the recommendation of saying people who are vaccinated should continue to wear masks. It's very likely that they're not infective. But just to be sure and just to be cautious, you want to be conservative on the side of saying, wait till we get data where we could definitively prove that. It isn't just me.
Wearing masks into 2022, Doctor? Do you still stand by that?
Neil, that was taken, come on, let's get serious about this. That was taken totally out of context. What I was saying,
so you don't think that's right? You don't think I should have masks in 2022? That shouldn't be necessary.
We don't know, and I'm not saying that we will. If we get a major surge and we have a continuation of an increase in cases, it is conceivable that we may be having to wear masks in 2022. The recommendation is not that you have to wear it. What the CDC is saying, that at minimum, wear a mask, okay? This is what they're saying. Make sure you wear a mask. So you wear a mask. Then you want it to fit better. So one of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
What advice do you have for families about what steps they can take to protect their children from the virus while we await FDA authorization for use of the vaccine for kids?
You know, my recommendation, Senator, would be really to follow the CDC guidelines. I mean, both when the children are in the home with vaccinated individuals, the guidelines are clear what needs to be done. When they're outside, many things you can do without a mask outside, but if you're not vaccinated and you're interacting with people outside of the home from different locations, you want to be careful and have the children have masks. So I think a good following of the CDC guidelines, which, as Dr. Walensky says, continue to evolve in real time as they get more data, the guidelines get updated and upgraded. So that would be my recommendation.
What study shows significant reinfection, hospitalization, and death after either natural infection or the vaccine? It doesn't exist. There is no evidence that there are significant reinfections after vaccine. In fact, I don't think we have a hospitalization in the United States after the 2-week period after the second vaccination. We don't have a death in the United States.
You're not hearing what I'm saying about variants. We're talking about wild type versus variants.
And what proof is there that there are significant reinfections with hospitalizations and death from the variants? None in our country. Zero.
Well, because we don't have a prevalent of a variant yet. We're having one. Can I finish? We're having 117 that's becoming more dominant.
Policy based on conjecture.
No,
it
isn't based on conjecture.
Variants, so you want people to wear masks for another couple years.
No.
You've been vaccinated and you parade around in 2 masks for show.
No.
You can't get it again. There's virtually 0% chance you're going to get it, and yet you're telling people that have had the vaccine, who have immunity. You're defying everything we know about immunity by telling people to wear masks who've been vaccinated.
No.
Instead, you should be saying there is no science to say we're going to have a problem from the large number of people being vaccinated. You want to get rid of vaccine hesitancy? Tell them they can quit wearing their mask after they get the vaccine. Okay. You want people to get the vaccine? Give them a reward instead of telling them that the nanny state's going to be there for 3 more years and you got to wear a mask forever.
Since there are so many people who are still unvaccinated, when you have enterprises or stores or businesses that want to open up, they don't know, since we don't have so-called passports to document that you've been vaccinated, they don't know who's walking into their establishment. There'll be vaccinated people, unvaccinated people. There may be even people who don't know it but are infected and may transmit it to others. So therefore, what we're seeing is that certain establishments are saying, notwithstanding the guideline and recommendation for vaccinated people, if you're going to come into my establishment, the rule is you're going to have to wear a mask because I can't distinguish between who's vaccinated or not.
Scientists interviewed for the article concluded, in most cases, a second bout with the virus produced milder symptoms or none at all. Given that no scientific studies have shown significant numbers of reinfections of patients previously infected or previously vaccinated, what specific studies do you cite to argue that the public should be wearing masks well into 2022?
I'm not sure I understand the connection of what you're saying about masks and reinfection. We're talking about people who have never been infected before.
You're telling everybody to wear a mask, whether they've had an infection or a vaccine. What I'm saying is they have immunity, and everybody agrees they have immunity. What studies do you have that people that have had the vaccine or have had the infection are spreading the infection? If we're not spreading the infection, isn't it just theater?
No, it's not.
You have the vaccine and you're wearing 2 masks. Isn't that theater?
No, that's not. Here we go again with the theater.
How has it changed what you do when you wear a mask?
Excuse me, how
has it changed what you do? How has it changed your mask wearing practices?
Well, you know, George, I'm obviously careful because, I'm a physician and a healthcare provider. I am now much more comfortable in people seeing me indoors without a mask. Before the CDC made the recommendation change, I didn't want to look like I was giving mixed signals. But being a fully vaccinated person, the chances of my getting infected in an indoor setting is extremely low. And that's the reason why in indoor settings now, I feel comfortable about not wearing a mask because I'm fully vaccinated.
For years, Dr. Ralph Barrick, a virologist in the U.S., has been collaborating with Dr. Shi Zhengli of the Wuhan Virology Institute, sharing his discoveries about how to create superviruses. This gain-of-function research has been funded by the NIH. The collaboration between the U.S. and the Wuhan Virology Institute continues. So do you still support sending money to the Wuhan Virology Institute?
We do not send money now to Wuhan Virology Institute.
Do you support sending money? We did under your tutelage. We were sending it through EcoHealth. It was a sub-agency and a sub-grant. Do you support the money from NIH that was going to the Wuhan Institute?
Let me explain to you why that was done. The SARS-CoV-1 originated in bats in China. It would have been irresponsible of us if we did not investigate the bat viruses and the serology to see who might have been infected.
Or perhaps it would be irresponsible
China.
to send it to the Chinese government that we may not be able to trust with this knowledge and with this incredibly dangerous viruses.
This latest email that we've seen, it was sent to Dr. Anthony Fauci, who everybody knows is the lead advisor to the past 2 presidents on the pandemic. This email actually hints way back in February last year that this virus could have been engineered.
These are the most extraordinary emails to emerge because we knew that Anthony Fauci knows more about gain-of-function research, and to remind everyone, because this is a relatively new term for viewers and everyone around the world really, but gain-of-function research takes place in laboratories where existing viruses often are either combined through a recombination event or mutations or some form of genetic manipulation to create they create even more deadly and infectious viruses. The point is to see whether they can be infectious to humans. So the idea behind it from these scientists is that they want to preempt a pandemic by seeing which viruses can infect humans by making them able to infect humans. And in the process, they create these new deadly viruses that never existed in nature before. Anthony Fauci is considered by some to be the godfather of this research. He has long defended it. As part of my investigation for the book I've written, What Really Happened in Wuhan, I did a deep dive into gain of function, and I uncovered a 2012 scientific paper he wrote. It was published in a medical journal where he said that the benefits of this research were worth the risk of a pandemic. It is an extraordinary acknowledgement. It is incomprehensible for a public health official charged with protecting public health to take this position, but that's what he has done.
All right, joining us now is one of the few who questioned Dr. Fauci's expertise and motives. As early as we did, Kentucky Senator Rand Paul. Senator, you are now calling for the firing of Anthony Fauci. What can you do in the Senate to get more answers than the ones that we have from these emails, which are still redacted?
Well, you know, I think we've had a sea change of opinion. Everybody left of center was saying this was a conspiracy. No way could it have happened in the Wuhan lab. Now even Dr. Fauci is saying that we should investigate it. But the emails paint a disturbing picture of Dr. Fauci from the very beginning worrying that he had been funding gain-of-function research. And he knows it to this day, but hasn't admitted. We have to get Democrat counterparts that will actually use the committee hearings to investigate this. But so far, it's been such a partisan support for Dr. Fauci that he can do no wrong. But really, there's a lot of evidence that he has a great deal of conflict of interest, and that if it turns out this virus came from the Wuhan lab, which it looks like it did, that there's a great deal of culpability in that he was a big supporter of the funding. But he also was a big supporter to this day of saying we can trust the Chinese on this. We can trust the Chinese scientists. And I think that's quite naive and really should preclude him from the position that he's in.
And referencing the point you just made, Senator, the emails, they show that Fauci was scrambling in those early days of the pandemic to find out the links between the NIH-funded gain-of-function research and COVID. Now, here's how one of his NIH underlings responded to this email about a 2015 gain-of-function study that was co-authored by the Wuhan Institute of Virology's Bat Lady. And he said, the paper you sent me says the experiments were performed before the gain-of-function pause, but have since been reviewed and approved by NIH. Not sure what this means, since Emily is sure that no coronavirus work has gone through the P3 framework. Explain that, Senator. Well, why is that so significant?
Here's, Laura, what makes it worse. 2 weeks ago in committee hearing, he said they did not fund any gain-of-function research. I quoted that specific paper.
Right.
So the very paper that he puts in the email, he says, oh my goodness, we need to read this paper because looks like we are actually funding gain-of-function research, which is where we juice up these viruses, take them from animals and infect them into humans. He's admitting that to his underling. He's worried about this in February of last year. But only 2 weeks ago, he tells me, oh, it wasn't gain-of-function research. But in his email, in the subject line, he says gain-of-function research. He was admitting it to his private underlings 7, 8, 9 months ago.
I mean, could there be criminal culpability here, given the repeated failures of Dr. Fauci, who is basically in charge of much of our messaging on this and advice on this? Could there be criminal culpability here, a fraud or ongoing collaboration with the Chinese when he was making excuses for them?
At the very least, there's moral culpability. In the research done by the bat scientist in Wuhan, she gives him credit. She lists the exact NIH grant with a 10-numeral disclaimer or ID number listing the money and thanking the NIH for the money. It's clearly gain of function. There are several scientists who are in this field, cellular biologists. They all say that taking a SARS virus and adding an S protein to it to make it infect human cells, that is the very definition of gain of function. It's very dangerous. We shouldn't be doing it here or there. But Dr. Fauci has denied it to this day. But the private emails show that he was acknowledging that it was gain of function. Nobody was questioning it. The scientific community needs to look at this because he hides behind this veil of the lab coat that nobody can question him.
Yeah, well,
I believe, and by looking at the evidence, that it absolutely was gain of function research, and he was funding it. And to this day, he's still saying he would do it again because he trusts the Chinese scientists.
Yeah. Well, one of those emails obtained by BuzzFeed, Senator, was from Peter Daszak of the EcoHealth Alliance. So he was the one pushing this and doing this research. And that was funded by NIH in Wuhan. So he wrote to Fauci on April 18, 2020, I just wanted to say a personal thank you for publicly standing up and stating that the scientific evidence supports a natural origin for COVID-19, not a lab release from the Wuhan. It's unbelievable.
Yeah. But here's the thing, Laura. Peter Daszak is not a disinterested party. He's not just looking for the truth. He was the funder of the research in Wuhan. So he has a self-interest in not revealing this because if it turns out the virus came from the lab, that's my point too. This is a big deal. So any investigation going forward, it can't include Tony Fauci, can't include Peter Daszak because they were the ones who funded the lab. They have a conflict of interest with coming to the truth.
We want to ask one more question, which is about the timing of the lift of the moratorium on this type of research, Senator. In January 9th of 2017, the NIAID released this statement saying, we have gone through the reviews, basically, we have all these recommendations as to why this type of research should be permitted. It was 11 days before Donald Trump is inaugurated. And it's like a 4 or 5 page memorandum. Don't you find that timing to be interesting?
Absolutely. So the NIH realized that gain of function was dangerous. They ban it for 3 years. And then right before Donald Trump becomes president, they allow it again. They start granting exemptions, all approved by Dr. Fauci. The committee's secret. They won't let you know everybody on the committee, but you know Dr. Fauci knows who's on the committee and reviews this stuff. But then they also allowed some of the research in Wuhan not to go before the committee. And when they were asked, why was this not reviewed by this committee on safety? They said, well, it wasn't gain of function research. So they basically defined it out of the purview of the committee that was supposed to be assessing safety and preventing, dangerous experiments from going on. So yeah, there's something rotten in Denmark, and somebody needs to get to the bottom of this, but it can't include Tony Fauci investigating himself. It's got to be an independent, bipartisan commission.
Senator, do you have any faith that a bipartisan commission, given the lies that have been put out there, 500,000 dead, and people are just looking the other way?
Yeah. We can't even get a hearing, but realize what they were studying in that lab they've admitted to was 15 times more deadly than the virus we're dealing with. COVID-19 has about a 1% mortality, and that's a lot of people, but SARS, the one from 2004, has a 15% mortality, and they were taking SARS and juicing it up and making it more infectious to human airway cells. That's a really scary thing to do, particularly for the Chinese communists, who I don't think are the most trustworthy of partners.
Yeah, well, and at least partly funded by the U.S. taxpayers. That is a scandal. Senator, thank you so much for joining us tonight.
Thanks, Laura.
I mean, saying you have to wear a mask when you're sunbathing, I mean, some of this stuff they've actually put out there. Even though you have Fauci in his emails is admitting the masks don't even stop COVID, even though he was, getting all the kids to be masked for all this time against the basic stuff. So we're going to be sailing hopefully very soon, but there's not been a single elected official in this country who's done more to liberate the cruise lines from a bureaucracy that is totally out of touch and that, quite frankly, is exercising authority that they do not possess under the law.
I mean, masks are very important. They protect you from giving infection to someone else.
Dr. Fauci once again under fire, accused of flip-flopping. The White House's top health expert now saying this about outdoor COVID transmission and mask guidelines.
It's pretty common sense now that outdoor risk is really, really quite low, particularly, I mean, if you were a vaccinated person wearing a mask outdoors, I mean, obviously the risk is minuscule.
Reports say updated guidance on wearing masks outdoors from the CDC could arrive as early as tomorrow. Now, that comes as a new study suggests our social distancing rules may have been misguided from the very start. That study claims that standing apart at 60 feet is no safer than at 6 feet, and that exposure time indoors is actually far more important.
Given, as you heard from the introduction, that I have been around for a while and have had the opportunity and the privilege and the pleasure of serving in 5 administrations, I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak. And I hope by the end of my relatively short presentation, you will understand why history, the history of the last 32 years that I've been the director of NIAID, will tell the next administration that there's no doubt in anyone's mind that they will be faced with the challenges that their predecessors were faced with. So for those who think that infectious diseases is gone, there's so many people who have made foolhardy statements not knowing at the time that they made them. I usually show a quote from an old Surgeon General or an old pundit in infectious disease. So I thought I'd pull this one out from Sir McFarlane Burnett, who was actually a Nobel Prize winning immunologist, who made the statement, as many did, to write about infectious diseases is almost to write of something that has passed into history. The most likely forecast about the future of infectious diseases is that it will be very dull, which is really kind of interesting coming from a semi-genius like McFarlane Burnett. And I think what he did, and the mistake that so many people have made, is something that several of our panelists have already referred to. And that is a failure to look beyond our own borders in the issue of the globality of health issues. Not only things that are there that will come here, but surprises that we have. What are the lessons that we learned from HIV? One, you have to commit substantial financial and human resources. These things don't get addressed spontaneously by themselves. You have to enlist the best and the brightest investigators in both basic and clinical research. You have to involve the community, be it the gay community in the United States, or the community in Africa and West Africa when we dealt with Ebola, or the people in South America when we're dealing with Zika. You have to have cross-sector collaboration. You can't do it alone. The CDC can't do it alone. The NIH can't do it alone. You do it with all of us, with industry, with global organizations, with philanthropy and NGOs, and you gotta get the leaders and the policymakers involved. What is for sure, that no matter what, history has told us definitively that it will happen, because infectious diseases, as I said 8 years ago in this article with David Morins and Greg Fokers, that it is a perpetual challenge. It is not going to go away. So the thing we're extraordinarily confident about is that we are going to see this in the next few years. Thank you.